Good morning, good afternoon, good evening, wherever you're viewing from. This is Laura Thompson with TAN TV, the African American Network, where we have a local feel with a global reach. And you're tuned into a very, very, very special edition of a conversation that we're going to have with a couple of physicians, a pastor, and a business leader from our community. The name of this segment is Come Together to Protect Our Village. We're going to be talking to churches and congregations about the importance and the significance of getting the vaccine. The vaccine is a hot, hot topic, and everyone is trying to find out how they can obtain the vaccine. And so we are going to be discussing this matter, this very important matter, with our community and our healthcare providers. And so good evening, everybody. Thanks for coming on and talking to us about this very important issue. So before we get started, I would like to go around and I'll call you by name to introduce yourself and tell people what you do and why the vaccine is very important for our community. Dr. Austin.
Hello, my name is Tommy Austin. I am the Chief Nurse Executive and Senior Vice President at University Health. And I am also a member of our senior leadership team that oversees our COVID response. And part of my responsibility was to make sure that we had personal protection equipment. That's how I fit into the equation, and also to encourage others to take the vaccination.
Well, thank you, Dr. Austin. And Dr. Diana Burns.
Hello, I'm Dr. Diana Burns, and I am a pediatrician here in San Antonio. I've been in practice for over 25 years. And my interest in COVID vaccine is because I am interested in this community. And as an advocate for children, I have to be an advocate for their parents. So making sure everybody gets the vaccine and understands what it means to our community has been part of my passion. So we're here to make sure people know it's safe and that we should all get it as soon as we can.
And Mr. Joe Linson is part of a business team, the Gradney Group here in San Antonio. Mr. Linson?
Hey, thank you guys for letting me come on. I'm also on the board of the University Health Systems Foundation. I think that's important for us to get that plug in. And also I'm a VP of operations for Tony G's, Chelsea's Catering in the restaurants. So it's important. But let me just say this very quickly. As African Americans, we're always kind of bottom of everything that's going down. And in this particular instance, we've been devastated with this COVID pandemic. So I'm encouraging every African American that's within the sound of my voice, get the vaccine. Don't mess around. We're taking the hits. We're taking more hits than we should be taking, and so it's important that we do this. Don't get caught up in the Tuskegee situation. What happened there? In fact, ironically, it was because they didn't get the vaccine. What people don't realize, nobody was playing any games. So this vaccine is important. I've had both shots. My wife has had her both shots. I'm in my early 70s, and so is she. So it's important for Black people get the vaccine.
Wow, thank you, Mr. Joe Linson. And then Pastor Patrick Jones.
Good evening, everyone. I'm Pastor Patrick Jones. I'm pastor of Greater Pilgrim Rest Baptist Church, president of the Baptist Ministers Union of San Antonio and vicinity. Mainly what we've been doing is trying to serve or aid in getting people registered. Those that have a desire to be vaccinated, I think that's so important that they have an avenue that they can go through to kind of help simplify the process. So we're hoping and praying that the supplies continue to increase and that our people continue to turn out and get themselves vaccinated.
So thank you so much. So tonight's topic is facts versus fear. And so we're going to address the facts And then we're also going to try to address some of the fears that people might have about taking the vaccine, and how that the facts can help you to kind of dispel some of those myths or the fears that you might have about taking the vaccine. So I want to start off and talk about vaccine hesitancy, because sometimes individuals have a hesitancy for some reason or another for not wanting to take the vaccine. So I wanted to address this first question to Dr. Diana Burns. I wanted to ask you, why do people not want to get the shot?
I think there are a number of reasons why people hesitate to get the shot, particularly people of color. I think the first is a mistrust of the medical community in general. As mentioned about the Tuskegee, some people are afraid because it's so new and it came so fast, and they want to wait. They're afraid of the side effects of it. So it's a number of reasons why they a lot of times will say they don't want to get it. But I really want to stress to everybody that these vaccines are safe. First, I want to let them know that there are really 3 vaccines that have been approved by the FDA. The first is the Pfizer, then was Moderna, and then the Johnson & Johnson's. The Pfizer and the Moderna vaccines have an efficacy of about in the late 90s. And what that means to you is that if it has 95% efficacy, it means that you have 95% chance of not getting the disease, which is wonderful. Those 2 vaccines are what they call messenger RNAs. And that's what scares people. You don't know really what that is. And it came so fast, you thought you never heard of it. It was developed in less than a year, and it was under administration that we didn't all quite trust. But messenger RNA technology has been around for over 10 years, and it is actually probably safer than what we used to do. Old vaccines, we used to actually give you a little bit of that germ and let your body make that. Now with the messenger RNA, it sends your body a message to make a protein, and then it excites your immune system. So they're actually safer than than what we've given before in the vaccines. And the technology is not new. So we need to dispel that myth that is new technology. It came too fast. And Johnson & Johnson's is a single vaccine that gives about 65% efficacy. But the important thing about all 3 of these vaccines is that they are all 3 effective against COVID-19. They keep you out the hospital, they keep you off the ventilator, they keep you alive. So which is the best vaccine? The best vaccine is the one you can get. So all of them are safe. So I think a lot of our myths, I think probably Dr. Austin, they did a survey looking at things about how you could get pregnant and cause you to have, I don't know, some couldn't get pregnant, and this whole bunch of things. I think a lot of those things get made up out of fear. But I think the biggest thing for us is fear of the unknown for us, and fear and lack of being educated about what this is. I think we know of all of the very serious things that happen to us. And I don't think anybody on this call has not been touched by COVID-19. So I'm hoping that we can educate people and alleviate some of that fear that they have, that they're going to have long-term effects or something's bad going to happen to them.
Wow. So thank you, Dr. Burns. And this town hall meeting and segment is brought to you by University Health. I wanted to go over to Dr. Tommy Austin. I know you are the Chief Nurse Executive for University Health, and you probably come in close proximity with a lot of patients that come in and out of the hospital due to the COVID-19 virus. And so I wanted to direct that question to you too about the vaccine hesitancy and why you think it's important that people should really consider taking the shot. But what have you heard about why people do not want to take the shot?
So what I've heard as a healthcare worker who rounds in the hospital on a daily basis is that for my young nurses, they're afraid that they won't be able to have children. So there's a rumor out there that the COVID-19 vaccine causes sterility, and there's been no science around that. I've also heard that they're afraid that they have a microchip in the vaccine. and that's not true as well. I think a lot of the fact that people have not taken the time to go back and read how this vaccine was developed using the Ebola research, I think that would help people understand that this is not something that was brand new, yet it was being developed to combat Ebola. So they did have something to start with as far as developing a vaccine. What my responsibility is to educate physicians, doctors, nurses, it doesn't matter, um, and encourage them to take the vaccine, because we all know that with 70% herd immunity, we can live a very normal life, and unlike what we're doing right now. So my plea to the public is to get vaccinated. All of my relatives are getting vaccinated. They saw me get the shot, so they're taking the shot. So I just want to encourage everyone, if you have access, like Dr. Burns said, if you have access to get a vaccination, get the vaccination.
Wow. And so I would like to talk to and direct this question to Pastor Patrick Jones. So Pastor Jones, you come in contact with a lot of people in the community, and as a pastor, and this particular segment is targeted to church leaders and their congregations. So what would you tell your congregations and other congregations about the importance of taking the vaccine, and what fears have been expressed to you about why individuals do not want to take it?
Well, we have heard some of the fears that Dr. Austin mentioned, um, from the chip in the serum to the sterility process and so on and so forth. But as I go back, when I think about people and all that they're going through, the questions that they have, I'm reminded growing up in the '60s, when we had um, diphtheria and some of those other things that were going around, and we got called in by zip codes. So I literally just I got the circle on my arm to prove it. We took a shot that we didn't have no research. I mean, there's so much information available to people now to see where the research and how the in my research I discovered it was a black doctor who really started the process that they're using today. So I share some of the facts that I have with people, but I've discovered, Laura, that there are a lot of people that want the shot, in spite of some of the negativity around, with a few. It's more than that want it than it is that don't. So we try to help accommodate those that want it. I think that we were children of the '60s. I think we came through just fine with a drug we knew nothing about. We just knew when our zip code came up, we went and took our shot. So I remind them of that, and I was comfortable. I was in the first dose line. My wife and I was in the first line to get vaccinated, and we were part of round one, and I haven't experienced any problems. If I did, I didn't know it.
Well, thank you so much. And I'm going to direct our next question to Joe Linson. So, Mr. Linson, I know you are constantly around people. You're a business owner, and you're a partner in a business, and you know, people are all around you all the time. And so, how important is it for people to take the vaccine? And when they're, because, we're all in public and we have to live in these communities together and come in contact with each other, how important is it to take, for people to take the vaccine? And what are some of the fears that you've heard from people as to why they're not interested in taking the vaccine?
Well, Laura, one of the main things is people are hesitant of the governor. I hate to say that. That's unfortunate. I'm here from the governor. I'm here to help you. We always get our back up. And again, I think being very candid, historically, as African Americans, we are we're always a little nervous about something we don't know about. Like Dr. Burns talked about, not having knowledge and how quickly it was put together. It caused some concerns. Oh, gee whiz, this stuff real? I've heard people say, if you take this, they're gonna knock off this is about killing Black people. Well, that's really ridiculous. But when you're nervous and don't have knowledge, it's easy to put fear out there and be a fear monger. And I think that what is happening with people like Dr. Burns and Dr. Austin and others in the community are understanding that this is not about killing Black people. We've been around here for 400 some years and we will continue to be here. But if we don't get this vaccine, there's a good chance you may not be here if you get sick with it. See, that's the whole thing now. We've got to move past all that old thinking. And there was some concern about, okay, here we go with something we don't know anything about. What is it going to do to me? How's it going to affect my body? Look, I'm 71 years old. I'm afraid of needles. I'm going to be very honest with you. I'm a wimp. I couldn't even feel the needle, to be honest with you. And there was zero side effects the first time. And we took the second one about 2 weeks later, no problem. It's not a big deal. I think that we've over dramatized the fear of the unknown. That's what that's about. So I think we need to dismiss all of that noise and take care of ourselves. We as Black people, we can't afford to lose anybody. We need all hands on deck. We need everybody in the Black community pushing forward and moving in the right direction. I'm on this UHS Foundation's board raising money for our public hospital out there. This ties right in. They're doing a super job with this. And Dr. Burns is on that board. Ira Smith is on the bigger board. And so it's important that we as leaders let people know that this is not going to have any negative effect on you. The negative effect is if you don't get vaccinated, there's a chance you'll get yourself sick and get through this pneumonia and you get on ventilator and it may be curtains. We've lost enough Black folk in Bexar County. I'm a little bit dismayed. I want to be very candid about this. I'm dismayed that the rollout, how we're getting it, started off kind of haphazard, calling 1,000 times, getting on email. And, a lot of these things don't have email. They can't register and get that appointment. So I'm so happy to hear Patrick Jones talking about they're getting another supplier and bringing in 2,000 more shots. And UHS is making this process a lot more smoother now. There's going to be a registry put out here so you can actually get on the registry. But I can't convince you enough, ladies and gentlemen, get the shots. If you can get it, get scheduled, get it done. I took the Pfizer, so there was 2 shots. The first one, a little sore in the one arm, but that's not a big deal. And for a guy that's afraid of needles, trust me, my wife will tell you, I don't like blood. I'm a wimp. But I went ahead and got the shots, and I didn't even know it was over. I said, "You done?" She said, "Oh, you done? You're out of here, Mr. Linson." And I have zero effects. So I'm just encouraging everybody to forget the myth, the fear, just get it done. Trust me on this one, okay?
You by University Health. And I wanted to direct my next question. This is a medical question, so this will be directed to first Dr. Tommy Austin. I wanted to ask you if someone had COVID already, should they take the shot? And if so, how long should they wait?
The CDC has suggested that you wait 90 days after you've had COVID-19, after your last negative testing. And so, yes, if you've had COVID, you should take the vaccine during the window that the CDC has suggested.
Okay. And so, Dr. Burns, can you expound on that a little more?
I think that everybody that gets COVID, they don't know how long the protection is. They're advised that you should get the vaccination. They've liberalized it a little bit. You can actually be positive on your COVID test for up to 90 days. Now they will let you get your COVID. If you are asymptomatic for 10 days after having the COVID and being asymptomatic, they encourage you now to even start looking at getting your vaccines a little bit even sooner than the 90 days. So I want to make sure everybody understands COVID is an evolving. We started this last March 15, 2020, which is an invisible year now, but so everything that we're learning about COVID is an ongoing process. So I want to caution everybody that if something changes, it changes because we gain more knowledge. It doesn't change because of we don't know anymore about it. But so as to getting your vaccine, having had COVID is not a reason not to get your vaccine. So having had COVID is probably more of a reason to get your vaccine than not. And if you've been asymptomatic for 10 days, you can get your vaccine then. So you should get it.
Wow. So I have a follow-up question with that, Dr. Burns. So can someone have had COVID and they don't know it?
Yeah, the symptoms from COVID, just like any other illness, can vary. The ones we hear about are the ones that are obviously the deaths and the people who have symptoms and get diagnosed. But there are a lot of people who might have a little bit of a cough, a little runny nose, slight fever that they don't even mention and have COVID. That probably the thing about that, and the thing that's not been we've not determined scientific, is your level of contagiousness during that period. A lot of illnesses, viruses particularly that we have and see, a lot of times when you are most contagious is when you first start and you don't have as many of the symptoms. So the fact is that you can be, basically somebody can be symptom free almost, or they consider themselves symptom free and have COVID. That's why, again, we want to stress it's so important that you still wear your mask, you still 6 foot distancing, and you avoid large crowds. That is still very, very important until we get to that magic number called herd immunity. So I cannot say that enough. Still do all the great things you're supposed to, even if you say you had COVID, and you can get COVID again. COVID is not a one-time illness. You can get it again.
Wow. And so this next question is addressed to Dr. Austin. So Dr. Austin, so you're around, people all the time in the hospital, being an executive at University Health. And so, so would it have the numbers been going down? I know in the news, some of the cases have been going down, but as far as people being hospitalized, what does that look like? And can you explain?
So in comparison to the last surge, we have seen a great reduction in the number of COVID-19 patients. We started out at one time during the summer, we had 4 of our ICUs that had patients with COVID-19, and we had multiple floors where we had acute care patients who had COVID-19. So we have seen a reduction, and scientifically, it has not been proven. However, I think because we've been getting the vaccine, we have seen a reduction in the number of cases that we've had so far. My concern is with spring break and some of the other super spreader events that we might see an uprise in COVID-19. And so, it would be nice if people could understand how devastating this disease is. It's not just when you're in the hospital. I have a dear sweet friend, and she's still dealing with long hauler syndrome. She started with having COVID in December, and she's still having issues with walking and pain in her legs and things of that nature. So it just doesn't end when you test negative. You can still have what they call long hauler syndrome.
Wow. So I guess I was going to ask you about the spring break activities and how you thought that might affect it, but I guess that part of it remains to be seen. So if the spring break activities does raise the number of COVID cases again, how soon will we start seeing that? Do you know?
So I know that we had spring break, I think started March the 8th. And so a lot of schools were out that week, and then the following week, schools were out. So I'm sure that we will see in a couple of weeks or so whether or not we had a super spreader event. Because I saw a lot of kids on TV with no mask, and they were in close proximity to each other.
Wow. So, so this goes out to Joe Linson. So, I know the NCAA is here in San Antonio right now. And so have you all come in contact with a lot of people in your restaurant or at the games or anything that?
Well, what we're doing, I'm glad you asked that question, Laura. What we're doing, we're requiring masks if you come in the restaurant. You know, you got the mask, we check your temperature, you have to sanitize. We're still spacing, even with the allowing more people in the building. We're still very careful there. All the staff are wearing masks, gloves, the whole bit. And we're careful there. Now, what has happened with the NCAA, fortunately for us, because we're still in business, we're actually serving. We serve several other teams, but what we do, we package the meal, individually package them, and deliver them to the Marriott River Center. We fed Oklahoma State, North Carolina State, Jackson State, and several others by individually packaging the meals. And when we show up, we're masked, and they have one person who's masked, and we don't really see the players. We're not even within a mile of them. We place the product on the table in the lobby of the River Center, and they take it from there. So everybody is being COVID aware and being aware of how dangerous this pandemic can be. And so we're on top of all of that. But it's been devastating to as you know, the hospitality industry. We've been out of the convention center for a whole year, catering side there. But the restaurant, we took some hits there as well. And the worst thing that happened, what people don't understand some of the impact, had to lay off a lot of people. And in the hospitality business, it's kind of a family affair. And having to let those people off or lay them off because, there's no revenue, the place was shut down, they put limited seating, et cetera, et cetera. So we had to take a real step back. And slowly we're coming back, of course, but there's it's not all negative. Let me say, here's some, for example, Uber Eats and Grubhub and all those entities were ordering, meals. They go online, order the meal from Tony G's, and they come and pick it up, following all the protocols, social distance, the masking, gloves, sanitizer, and all that. And so there's been some positive. We're slowly getting back to what we would have called normal, but we're not there yet. We've got a long way to go. A lot of revenue was lost. We're bringing people back on board, hiring more people. And that's always a good thing for us because, as you may know, Tony G's and Gradney and Mary and those people, they really believe in second chance opportunities. And we've had to, move away from that, but we're still looking to, in fact, now we're actually looking for people. We're having a hard time finding people to come back. Folks have been off so long. And the good news is, again, our government, which is not all bad, they're having, with the unemployment, so people are still getting a paycheck at home. But as you know, nothing is forever. And that's going to run out. So we're trying to get people to come back to work and be safe. And when you feel comfortable, come back. But we're doing everything protocol-wise to be sure that we're cognizant of how dangerous this pandemic has been. And as Diana Burns said, it continues to be. We're still losing, people still dying every day. Okay, here in Burke County, you don't hear a lot about that. They are. And I'm very concerned about this spring break stuff too. A lot of these young people, we've all been young. I'm not going to beat them up too much, but come on, people, mask up. I've seen casts at every length. Young folks can die, okay? And you need to understand that. So be safe. You can party all you want. I'm one of the big, I used to be. You can party all you want, but be careful how you do it. I think the key thing is the mask and stay away from a whole bunch of people. And work it that way. So we're still in a challenging period right now. I think we'll overcome this. There'll be something. There's always something, as you can tell. There's something always happens. And again, being African American, particularly African American male, I know what we've overcome. This is a tough one. This came at us out of nowhere. We had no idea what the heck this was. And then, it's the vaccine and, we've had smallpox. I'm old enough to know when we used to get a smallpox vaccine, a polio rather, on a sugar cube. So we're not unfamiliar with vaccines. It's just, this is a whole new approach to vaccines. You got the various pharmaceuticals who are doing a super job, and they did warp speed this. I know there are some folks upset with the last guy who was in office, But the fact of the matter is, he's gone now. And these vaccines are out there. Get them if you can, and get them as soon as you can, because you never know who it may strike. I mean, grandma, your kids going in and out. I've got a grandson who lives with me, and he got his the other day. I was happy as hell. I was more happy for him than myself. And so I just simply say, look, be smart about it. Let me just say it like that. Be smart. All of us can read and write and think for ourselves. Wear the mask, back up from people, be careful. I'm still wearing a mask. I've been vaccinated. I've had all that, but I'm still cautious. And I'm encouraging our staff and everybody who comes to Tony G's to do the same thing. So hope that helps.
Well, thank you so much. Thank you so much. That's great information. And Pastor Jones, I saw an article in the paper recently, a couple of days ago, as a matter of fact, where you were interviewed about the vaccines and congregations and churches. Can you expound on that?
Yes, ma'am. That was with the SA Reporter, SA Report. But again, with the churches, we're thankful for some of the relationships that we've made, even the relationship that we've made with Dr. Burns, and we were able to assist in getting people registered through them and their efforts, and some of the other private relationships that we've made. Even a new partnership that we have that we'll be giving out. Probably about another 2,000 shots a month through the new partnership that we have. So we're going to continue to encourage people, to help people get registered to take those shots. Our churches now are going to be some locations that they can actually come and get shots. We're going to start next week. I think that's the 7th and the 8th with New Covenant and True Vision. So we're going to start at those two locations on the 7th and 8th. They can actually come and get vaccinated right there on the spot. We may even start this week registering them, so to kind of speed up the process. So it won't take us all day to register and give them their shot the same day. But those are some of the things that we're doing through the church's relationships. I think it's so important that our churches are become a vital part of this effort. When you think about it and you look at it, really, the church is one of the last businesses to even start to reassemble. Most of our churches are not even reassembling because of COVID. And I won't say it's been easy. The churches have had their struggles, just like, or maybe worse than some of the other businesses. There's a survey that's going on that say about 30% of the churches will not recover. 30% of the churches will not come back from this COVID pandemic. But we believe if we help bring society back to some sense of normalcy, maybe we can escape that loss happening. Maybe we can help some other churches recover by bringing some sense of normalcy back, and then praying that people want to come back. That's where we are also. Some people getting comfortable staying at home viewing it virtually, but we want to see people come back to the house of God. And I think by us helping to encourage people to get vaccinated, we'll do so.
Wow. So could you clarify something for me? I know you talked about having some vaccines available at True Vision and at New Covenant Baptist Church. Will they have to register for those vaccines, or how does that work?
It'll be done two ways, and we're going to get the information out after Tuesday. We'll start to disseminate the information. But if they miss the registration period and they happen to go to one of those locations, we're going to have 500 to 600 doses for each location, and that should be a weekly process. So It won't always be at the same two churches. We're going to move it around because we want to take it to people, but we'll start out with those two churches. But for the most part, you'll be able to get some vaccinations there on site if you miss registration, depending on the amount that we have. But we are going to open it up for registration this week. It'll be posted. Laura, you'll hear from us, and we'll make sure that the information gets out.
Okay, well, thank you so much, Pastor Jones. So Dr. Burns, I understand that your office and you as a physician have taken the initiative to ensure that individuals get registered and vaccinated. So can you tell us a little bit about how that works and how that's been working for you?
Certainly. So that is something that we started out of that we thought was a need, and partnered with a university system. Actually, it started out as something I thought was going to be that maybe we could do a big kind of a push and have one big day of vaccinations for people, because we hear all these things about vaccination hesitancy, and people don't have transportation, and maybe they're illiterate on the computer, and all of those things that we said would definitely interfere with people who are very vulnerable and people who are of the lower economic status. So I went over and talked to Mr. Hernandez, who's the CEO for university and is quite a visionary. I talked to him about doing a one-day big push for giving vaccines to and targeted the vulnerable communities, particularly minority communities. He agreed. We looked at the facility out there at Wonderland, and he came back with much more than I asked for. Rather than letting us do it one day, he committed to letting us do it every day. He started out with giving us a number of patients. Now we are allowed to do at least probably close to 200 people a day that we can get in with him. When he told us that, it was kind of a surprise. So I said, oh my God, how can we do that? We planned on doing this big thing. So I went back to 3 of my cohorts who I always ask when it's time to figure out something. Miss Bunny Elder, Mr. Lynn Burley, and my workhorse person who is my CFO for COO for South Texas Center for Pediatric Care, Ms. Francine Prosser Johnson. And we said, okay. Next, we talked to our state representative, Representative Barbara Hawkins, and she called in the leaders, and we said, let's how we can do that. We had a Zoom call. I want to compliment and thank Reverend Jones for being on that call and giving us we had some spirited discussion, some doubts thrown around, but at the end of the day, like, we came together. We all realized it takes a village to raise a child, and it takes a village to get us vaccinated. So we all came together, all pitched in, and talked to a little student over at the university. She built us an app, and we were in business. We've had everybody participating. We looked at all the reasons we thought people couldn't get there, like transportation. Found out that transportation was really not as big an issue as we thought. It was about 5% of the almost 6,000 people we have registered who thought transportation might be a problem. But when we, just like this group came together to say we could do it, when we say we might have transportation as an issue, churches came out, said, well, we can take them. Community people came out, said, well, we can take them. So nobody could not get a vaccine because of transportation. We made it easy. I guess it's people have all volunteered. We've got a couple volunteers from Ella Austin there working with us, taking phone calls. We got the pastor's wife being I guess a road warrior, doing probably 100 outreaches every day for us since February the 5th. It has been such a great community effort for us to end up at this point with over about 6,000. It's 5,920 people registered at this moment. We've given 5,000 shots. 1,500 of our people that we have registered have been over 80 years old. So we targeted that population, and it has worked for us. So we've got, I don't know exactly number, but our oldest patient we registered was 106. They did not hesitate to get the vaccine. They did not question, they did not ask. What they asked was, when do I get my next shot, is what they asked. They just, so they have been very enthused about it. And I think a little bit of what we were afraid of, obviously the computer is a big different problem, but I think that some of the issues, it was not hesitancy that they didn't want it. It was just a difficult process in being able to get it at times. And the university has just been a champion. We talk to them every day. They let us download our patients every day. So they're pre-registered when they get there. The process takes them 15, 20 minutes to get there. They give us a time span. You couldn't make it any easier. So efficiency, I think leadership over there, including Dr. Austin and Mr. Hernandez and Mr. Phillips, they have been just champions for our community and doing whatever they could to see if they could get us. And 48% of our referrals come from the church. So the church is still a powerful place in our community. So 48% of the people, almost 50% of the people that we have vaccinated have come through our churches.
Wow, so thank you for that great initiative, Dr. Burns. And we're gonna just take a brief pause. Uche Public Relations is going to be doing a giveaway right now. And so we're going to pause for a little bit, and then we're going to come back in a few minutes and wrap it up and get more and more great information. So thank you.
Hello. Thank you so much, Laura. I'm so excited for this conversation. Thank you so much to all the panelists. My name is Christian Reed Agba. I'm from ECU Public Relations right here in downtown San Antonio. We are super excited to partner with University Health and TAN TV to bring you this conversation. And yes, we have giveaways. So all this afternoon and all of this week, we've been talking about the $250 Amazon gift card, and we got a couple of additional gift cards to give away as well. The comment section right now is jumping. So you probably see me in there a little bit in the comment section, just trying to move the conversation along, making sure folks are dropping the names of their churches in that comment section on Facebook. And this is only during the live discussion where we'll be giving this giveaway away. So if you're catching the replay, so sorry, you might have missed out. Or you can catch us at the next town hall, which will be Wednesday, March 31st at 5:15, right here in the same spot on Facebook. Or you can catch us later on in April 13th at 5:15, right here on Facebook as well. So we got some really cool people in our chats, and they've been talking about their churches, and they've been asking a couple of questions. It's actually really good to see that some folks have already gotten their first and yet their second shot. So that's super amazing. Our community is really coming together to protect our village and get the vaccinations. At the same time, right now, we're fighting misinformation. So we ask that you please share this video, share this live chat, share this live feed with your network, and help fight misinformation in the Black community and help get more of our community vaccinated. So right now we have about 4 tight entries for the $250 gift card. So I'm gonna give you about 5 more minutes to go ahead and mention some churches. It's not fair to just have 4. There's so many amazing churches in San Antonio. We've reached out to about 50 alone. So we want just a little bit more representation. If you've already named your church, go ahead and drop it just one more time so that we can make sure we got an accurate count and we get that winner announced right after this last Q&A. Laura, I'm going to send it right back to you. Again, thank you so much, University Health and TAN TV, for joining us on this process. And thank you all the viewers and, of course, the panelists for sharing your amazing, amazing information and knowledge with us. Back to you, Laura.
Alrighty. Thank you, Christian. Thank you so much. And so while we're tallying up more church entries, I have one final question, and I think then we'll give everyone an opportunity to kind of give a wrap-up statement. But this is for Dr. Burns. We're gonna ask everybody this question, but Dr. Burns, why are minority communities more likely to have more problems with COVID?
I guess We know that COVID affects people who have certain conditions. We have more problems with diabetes, high blood pressure, heart disease, all those kind of obesity, which is a condition. We need to realize that predisposes us to COVID. And we know from just the statistics that people who have those conditions are predisposed to have more complications from COVID. And the fact that we as minorities have more problems with that means that we will have more problems with COVID. We make up, and I can't quite remember the number, we make up maybe 4% of the population, but we make up almost 40% of the deaths and the complications that come from COVID. So we have problems that are because of our health, because of our lifestyles, because of our stress. And I do believe being Black is a stress. So I guess my advice to all of us as we talk about COVID, COVID is an acute thing that's happening this time, but it will be another COVID. We might not call it COVID. We might not call it COVID at that time, but it will be something else. And we as Black Americans, as African Americans, need to figure out and help to fix ourselves so that we will not be so predisposed to have problems. So we need to look at the reasons for our diabetes, our hypertension, our obesity, all the things that make us more vulnerable. We need to figure that out. So the next time we have COVID, or next time we have pandemic, or next time we have whatever it is, we're not the people who are the most vulnerable.
Wow, so the same question, a little bit differently, is going to be directed towards Dr. Tommy Austin. Dr. Austin, since you're in the hospital and making rounds and checking on people, what are some of the health conditions that are most prevalent to individuals that either contract COVID or that die from COVID?
Well, the major issue that they all have when they are close to death that's respiratory distress. And so if you're an asthmatic or you smoke or illicit drugs, there's a higher opportunity for you to get COVID-19. And so one of the things we want to encourage is one, be healthy, exercise, eat right, be active. And we also want to make sure you look at your diet. One of the things I was able to do during this pandemic is to go more plant-based. And you'd be surprised how many good soul food plant-based restaurants there are in San Antonio. So there's just a big opportunity for us to change our lifestyle, be healthier, and like Dr. Burns said, be ready for the next pandemic, because she's right, there might be another one.
Wow. So Pastor Jones, as a pastor and leading congregations and also leading an organization that has leaders for congregations, what are some of the things that you would tell your congregation or ask your pastors to pass on to congregations about, some of the health conditions that African Americans suffer with, but also can contribute to catching COVID or being contracted with COVID or even dying from COVID? What information would you pass on to them?
I think the pastors are affected by COVID deaths more than anyone. We still have to bury them. Whether we have large funerals or closed funerals, whatever, we're still dealing with them week after week. And we see the statistics of about the obesity issues and so on, hypertension issues. We understand the health conditions that are associated with the virus. I would like to see Dr. Burns and Dr. Austin, and maybe you too, Joe, see us come together and start doing some get healthy rallies. I think that would be a great idea. Soon as the numbers get a little bit better, I think we can do something proactive to help our people instead of being reactive. I think that's one of the greatest challenges of the Black community is we're so reactive. But I believe we can take some proactive steps. We can use the assistance of our doctors, Joe with their dietitians, plant-based. Let's just get a start on getting healthy. And I think if we come together, we can do some great rallies.
Wow. So Dr. Austin was talking about vegan-based restaurants, soul food restaurants, or whatever that you've gone through. So, Mr. Joe Linson, so you're a VP at a soul food restaurant. Do y'all have any vegan recipes on your menu?
There's no doubt about it, Laura. We've got vegan platters. Some of our best products are not the meat. Okay, I mean, sweet potato yams are good. Yams carried Black folks for years, so we've got all kind of stuff in that regard. But let me just say this in closing up. First, I want to thank Tan. Thank you, Laura, for what you're doing. Media, our media, nobody's gonna save us but us. And you guys and your media, I've been with you, Laura, for a long time. Christian and Uche, with you guys as your PR world, we've got to get our message out to our people. UHS is doing a super job. Dr. Burns, you guys are fantastic. Tammy, I know you well. I know your passion for this. Let's understand that. Now, let me just say a couple other things real quickly. Our diet is a big deal. That's very important. Even while we all been locked down, we've been sitting around here at home eating a lot and in fact drinking a lot. And in fact, I may have picked up a couple of pounds because you sit around and it's just a nervous habit. So we got to be careful there. We do suffer diabetes and high blood pressure and just the stress of being Black in America. I'm just going to be honest about it. We've caught hell in this country, but we have overcome so much and we will overcome this. But it's important, though, that what Patrick's talking about, we need to be conscious of our health. The older we get, even be more conscious. We start off young, trim, and slim, and looking good. And before you know it, you pick up a few pounds, and they're harder to get off. And so no sense in adding to our misery. These comorbidities are huge with us. I see a lot of people who, frankly, need to push back from the table. I'm just going to be honest about it. Look, we need to keep living. We need our people here alive, healthy, and strong, getting out and walking around. You can walk by yourself, wear your mask, but still get out and walk. Get some vitamin D. The sun is one of the best health things we have, and it's free. Just get outside, stretch a little bit. Those things are important. And I agree, diet is our lifestyle. We got to watch what we do there. Ultimately, everything in moderation is my key. You do anything you want to do, but do it in moderation. Eat what you want, but do it in moderation. I love fried chicken, but I take the skin off, for example. So there's some things you can do. I'm eating more vegetables. I know, in fact, I love spinach. Spinach is one of my favorite things now. And squash and cabbage and stuff like that. We can do all of that. Stay away from all this pork. I know we like our pork chops smothered and all that. Again, in moderation. The key is moderation. If you want to be here, you're going to watch what you're doing. This body of ours, we've gone through a lot in America as African Americans, and we are stronger than we've ever been, but we're going to have to come together as a unit. I think what's happened with Black people, we tend to, it's okay, let's think Black, and we think that's at the expense of someone else. I love everybody. We're not anti anyone, but as a group of people, we need to circle the wagons, particularly here in this town. We're not the largest minority. We're not even the majority of District 2. But as a group, as a united group, thinking Black first, not anti anyone, we can make things happen. I've had the vaccine. I encourage everybody to get it, get the Pfizer, get either one that's available. And I encourage our leaders, make this simpler. You don't give us a register so at least people can feel more at ease knowing that they're on a list. It's just a matter of time before they get it. And while we're waiting to get that shot, be smart. I'm telling my young people, I love you, my young brothers and sisters. You guys are beautiful. You have so much talent. Don't waste it by being a fool about it. Mask up, keep your distance, and still have a good time. But the key to all of this, ladies and gentlemen, is moderation, moderation, moderation. That's kind of my wrap up on this, guys. And thanks for this event. This is fantastic. Us getting this word out through media is super important. And we're actually saving lives right now. UHS has saved lives. I did mine at Wonderland Mall. It was a beautiful experience. You go there on the top level for the first one. When we went back, we went to the second level, And really, it was just really a matter of minutes that they made this happen. All those professionals out there. And so I'm gonna one plug in for University Health Systems Foundation. You'll be hearing from me asking you for some support financially. So what that foundation does is support the hospital and support all the miracles that's going on out there. So let's support each other. Dr. Burns is on that board, Ira Smith's on that board. Let's show this community that African Americans understand what's going on. We know the plight we're under. We know that we're a target, have been a target for 400 years, but we're still here alive and kicking, and we will continue to do it if we take care of ourselves. That's my 10 worth.
So thank you, Joe. We appreciate those comments, and I think it's time for Christian to come back on and talk about the winner for the $250,000. I mean, I'm just
Wait,
kidding.
how much look? Ooh,
Just
ooh.
kidding.
I almost gave myself a pre-existing condition. Okay.
The $250 Amazon card. Go ahead, Christian.
Yes. Okay. We had some cool interactions in the comment section. And if you are in the comment section right now, you know exactly what I am talking about. And you all got to work naming off your churches. Isn't it a blessing to have a full congregation that just loves you? Greater Pilgrim Rest Baptist Church. You all are the winner of a $250 gift card to Amazon. So hopefully we'll help you get some technology for your church, or some things, some food items for your food pantry. So you're so awesome to have so many people tuned in, supporting you. So thank you to the Greater Pilgrim congregation that is in the comment section, getting this good quality information. I am also going to take a leap of faith. And you know what? I'm going to shout out Bethel AME because y'all came correct today too. So I'm going to go ahead and throw you guys a $100 gift card to Amazon. Hopefully we'll be able to pick up something nice for you all there as well. This has been an amazing conversation. Laura, I am so astounded at the conversation and all of the good news that was able to come out. The comment section is jumping. So that means we need to have more talks like this more often. Conversations focused on us and our community. I feel warmed knowing just how many people came seeking information, asking questions, and getting the answers that they deserve, that we all deserve, the care that we all deserve. I want to say thanks to University Health for bringing ECHU Public Relations and Chan TV on board and supporting this conversation and this programming. GetVaccinated.sa.com is their free resource to get all of the information. All of your FAQs are there. All of the information you need on how to secure a vaccination. As Joe already said, you can also find more information. Go on up to Wonderland Mall and figure it out, and make sure that you are actively seeking to take your shot. And as always, bring someone with you. Come together, get the vaccine, and protect your village. This has been a lot of fun. All week long, we're going to be doing some more giveaways. We have another town hall on Wednesday, and that one's for teachers and school administrators. And what that conversation will be geared towards school safety and parent safety and teacher safety. And we're grateful that University Health will be back on board, and we'll have Dr. Tommy Austin, you're coming back, and we got a couple of people coming back. Which is great. That means this conversation is going to progress. It's going to grow, right? And so we're going to be just discussing with our school administrators, our teachers, and yes, parents, you should definitely tune in at that moment as well, discuss some safety about the COVID-19 vaccination. We'll probably have more national updates. This whole process has been riddled with national updates. So we want to make sure our community is staying informed. So visit GetVaccinated.sa.com at your earliest convenience. Google the panelists, learn about them, learn about the level of expertise you were able to receive for free today, and make sure you tune into TAN TV on Wednesday for the upcoming Town Hall number 2. Thanks so much, Laura. Back to you.
All right, thank you, Christian. Isn't Christian amazing? She's one of the most amazing women that I know. And we really appreciate the opportunity to work with University Health and with Uche Communications. Well, ECHU, Uche is one of the owners, but ECHU Public Relations, we really, really appreciate that partnership. And so we have a few more minutes. And so briefly, I'm going to ask each one of the panelists to what can you do to promote vaccination, or what are you doing to promote vaccination in the minority communities?
I don't know, since I've been starting, I'll start this time. I think we've explained what we have done, but I want to echo and challenge Dr. Jones to what he said, a health rally. I think the one thing that we did not mention during this thing that COVID has, during this conference, is that COVID has taken a tremendous toll on our mental health. And I think I want to challenge him for my vision to do a healthy rally. So we will talk. We've already proved that if we get the right people in the room, we can do things. So my thought that I'd like to leave everybody with is get your vaccine. It does not matter which one you want to get, but the one that you can get will always be the right one. So get your vaccine as soon as you can so we can go back to normal.
Right. Pastor Jones?
Okay, yeah. Dr. Burns, I'm gonna be looking forward to that call from you, because I am anxious to get that good healthy rally going. And Joe. So we'll get that going. Just want to say, get vaccinated. We need to get back to some sense of normalcy. We don't know how long that's going to be. I want to share with the community. A lot of our churches a few have gone back and discovered that very few people are coming back because of the fear, of the crowds. So we're still struggling with those issues. So some of our churches we're going to try to survive through the end of the year to give our herd immunity time to work. But whatever the case may be, we want to encourage people to get vaccinated. Maybe we can help speed up the process once again. And I got to give a shout out to Elder Raymond Bryant, presiding elder of AME Church. He's been a great joy to work with, his wife and all of them. They have done a great job at helping us put things together. And we look forward to a better relationship with our faith-based community so that we can help assist in getting more and more people vaccinated.
Wow. So briefly, Mr. Joe Linson.
Laura, look, our churches have been our salvation historically, African Americans, and you know that. Without a faith-based community, where would any of us really be? So I'm with Dr. Patrick on this. We need to make sure that we get as many people vaccinated so we can get back together. I think that's part of the mental health aspect that Dr. Diana Burns is talking about. If we're not spiritually filled, we're going to be mentally weak. So it's important that we get the vaccine, and it helps relieve stress. I felt so much better and I was nervous about it, but I didn't show it. But it probably was coming in other ways. I said, man, because I got frustrated trying to get ready and all of that. And then it finally happened. I felt a lot better. And I'm sure others feel like me. Look, Blacks, people, knowledge is power. Get up to speed on this. We need you. You can't help us if you're gone. Okay, we've lost too many Black people already, and they're gone. We pray for their souls. Hope they're resting in heaven. We don't have the luxury of that. That's the point I'm trying to make. We don't have the luxury of losing any troops. Our preachers are doing their part, and they need us back. They're feeling kind of lonely out there in these big old buildings we've built for them, that you've built for them, and we can't go there. It's time that we get back in church. It's time that we go, and then do it safely. We're going to be with masks and this scans and nervousness for a long time. Accept that. Let's just go ahead and accept that. This is our new reality for a while. But slowly, as more people are vaccinated, you get this herd immunity where the community is, okay. We can get those people back in those pews, and preachers can do what they do best, is save our souls. It's all about our salvation. We've come a long way, people, and we have a long way to go. This is an excellent time when if you come across a politician wanting your vote, You put them on the spot, make them commit to what we're talking about here today. Ask them what resources are they going to provide to get us back to where we were, get us back to normal, or some sense of normalcy. See, we have power.
I agree.
But it's
Mr. Linson.
first.
I agree.
Okay.
And we're running out of time, but I appreciate your comments, and everybody. I would like for you to take heed to what Mr. Linson is explaining to us. I wanted to give Dr. Austin an opportunity to just maybe 30 seconds to give us a wrap up from University Health System.
Well, first of all, from University Health and to ECU Public Relations and to TAN TV, thank y'all for giving us the opportunity to share the information. And all I can say is continue to wear the mask, continue to sanitize, and continue to social distance. We're not done yet. And when you put at risk yourself, you're also putting a healthcare provider at risk. So please, please, please do what the CDC has instructed us to do.
And you've been tuned into TAN TV, the African American Network, where we have a local feel and a global reach. And we want to thank our panelists, University Health, and also Echo Communications, Public Relations for this opportunity. And I hope you all take heed to with the community leaders and health professionals information that they've given us this evening. Thank you, and we'll see you on Wednesday for another town hall meeting. Ciao.
Awesome. I think we're still live.